Going to be giving a medication today. I'm in the medication room. Going to be giving the medication by the 6 rights: the right patient, right route, right dose, right date, right time, right documentation. I'm going to check the doctor's orders. He's calling for 0.5 milliliters of the Tdap vaccination. I'm going to check that against the MAR, and they match. And I'm going to go to my medication dispensary and type that in. I'm going to get it out. It's a multi-dose vial, so I'm going to double check it was initialed and the date was open today. I'm going to check it for cracks and particulates and check the date on it, which is 04 of 2027. And I'm going to check that against the MAR to make sure that it is in fact the correct drug, and I'll be withdrawing 0.5 milliliters. I'm going to set that down. I'm going to wash my hands and dry my hands. I'm going to open up an alcohol swab. And I'm going to clean the vial. And I'm going to set my alcohol swab off to the side here. I'm going to let that dry for 30 to 45 seconds while I prepare my syringe. Get that open. Got a 3 milliliter syringe here. I'm going to pull out the desired amount, which is 0.5 milliliters in air. And that should be dry now. We're going to go ahead. I'm going to instill the air into the vial and then rotate the vial to 90 degrees. Where I can see where the needle is. Now to get the extra bubbles out of there, go ahead and there it goes. All right, wonderful. Then I'm going to push out until I get to half a milliliter. Then I'm going to pull the needle out of the vial. It is at half a milliliter. I would have set my cap on a clean surface, though I didn't this time, so I'd probably end up getting a different cap. But for now, and secure the needle. All right, now we're going to go into the patient's room, so I'm going to bring all of my equipment, the vial, and the medication in with me, and set it off at the patient's bedside. Hi, Bob. It's Bobby. I'm your nurse, as you recall from earlier. The doctor ordered a Tdap vaccination for you. That's a tetanus and diphtheria and pertussis vaccination, and we're going to be giving that in your left deltoid, since we're just still picking on the left arm today. I'm going to go ahead and check your allergies. Do you have any allergies?
No.
And can I get your name and date of birth?
Bob Johnson, 4/12/46.
All right. I thought it was pronounced Janssen.
Some people say that.
Oh, okay. Sorry. And then I'll check that against the MAR, and that does come back as correct. So I'm going to go ahead and wash my hands now, dry my hands, and I'm going to do another check on the medication with the MAR, and it is the correct medication, is the correct date. I have the correct patient. I'm going to be using the correct route, which is IM, and the time is now, and then I'll be documenting it correctly later. I'm going to go ahead and put my gloves on. Maybe. And then I will take my medication over here. We're going to select the right site, which is the left deltoid. We're going to be measuring 2 finger widths down from the acromion process and putting it right there. Unfortunately, Bob's arm has to be down flat on the bed, so we'll make do with what we have. I'm going to cleanse the site once I locate it, 2 fingers down from the acromion process. Cleanse in a circular motion. Set that to the side. I'm going to let that dry for 30 to 45 seconds.
I think it's dry.
Okay. It's been 30 to 45 seconds. I'm going to remove the needle. I'm going to secure the site and insert the needle at a 90-degree angle. Going to withdraw the plunger to aspirate for blood. There's no blood returned, so I'm going to inject the medication over approximately 5 seconds. Hold there for a second, and withdraw the needle, which our patient's arm decided to squirt. And then I'm going to walk this over to the sharps container and come back. If it's bleeding, I can take a dry piece of gauze and blot at it, but not massage, of course. How'd that feel, Bob?
Oh, it was all right.
All right. So then I'm going to document the location, which was the left deltoid. I'm going to document the amount, which was 0.5 milliliters, and the patient's response to it. Is there anything else I can do for you, Bob?
No, that's all right.
All right. We'll see you here in a little bit.
Okay.